Okay, thank you, Madam Chair and member of the committee. It's a pleasure to be here this afternoon, and thank you for letting us go first because we will be very efficient. My name is Senator Jackie Dingfelder, and I represent parts of Northeast and Southeast Portland and Maywood Park around the northern part of the state. I'm here to share support for a bill in front of you, Senate Bill 420, and I have some folks who are going to share their stories with you here in just a little bit. According to the Center for Disease Control, breast cancer is a leading cause of cancer-related deaths among women, killing over 40,000 women in the U.S. in 2009, which is the latest statistics that we have. The good news is with the use of mammography, we're able to catch cancer earlier and when it's more treatable. However, mammography is less effective at catching cancer in women with dense breast tissue. Dense breast tissue is comprised of less fatty tissue and more glandular tissue. What this means is that on a mammogram, and you do have handouts in front of you with a visual so you can see that, dense breast tissue appears as white, the same color as tumors, making it very difficult to see early stage cancers. In fact, mammograms typically miss 40% or more of tumors in women with dense breasts. Welcome, rest of the committee members.
Thank you. Apologize.
In addition to masking cancers, dense breast tissue is an independent risk factor and can be a greater risk factor than having two first-degree relatives with breast cancer. Yet very few women know the risks associated with dense breast tissue, let alone their own dense breast density, and that was something that I learned recently when I was called back after a mammogram, and I had no idea that I actually did have a dense breast tissue as well. Senate Bill 420 seeks to raise awareness and educate women about dense breast tissue, and this bill would require a healthcare facility or radiologist who performs a mammogram noting dense breast tissue to issue a notice to the patient educating them about the dense breast tissue and risks associated with this issue. This would allow women to better understand the risks that they face of getting breast cancer and to understand the limits of mammography. It will also prevent more stories like the ones that you will hear in a moment from the ladies on either side of me. And also, you will hear that they did everything that they could, yet the doctor still missed cancer for 2 years. Both state and federal standards require comprehensive coverage of mammograms to ensure women have access to affordable breast cancer screening. However, for the 40% of women with dense breast tissue, mammography is less effective. While mammography is the most widely available screening test for breast cancer today, and while it does save lives, it is important to recognize that mammography has major limitations, especially for women with dense breast tissue. In addition to ensuring women understand their breast density, Senate Bill 420 will also require insurance coverage of breast ultrasounds if a woman has had a mammogram and a doctor determines that she has dense breast tissue and recommends another screening procedure. If mammography is to be used as a base-level screening procedure, and therefore a covered procedure, we must consider the fact that mammography does not always work for a significant part of the population. We must also make affordable screening alternatives available. So I urge your support for Senate Bill 420 as it will save lives by educating women about the risks of dense breast tissue, make them aware of alternatives to mammography, and require women with dense breast tissue that they have access to affordable screening alternatives. By passing this bill, we will increase early detection of breast cancer and improve survival rates and ultimately save lives. You're going to hear firsthand from these women. I do want to mention that we did receive a fiscal on this from the Oregon Health Authority because of the impact for the Oregon Health Plan and the folks that we cover, and certainly we are interested in having discussions with the committee about that because obviously there is a cost involved. But I think it's really important at a minimum to have the education component of this bill to educate women. With that, I'd like to have our guests tell their stories, and then I will stay and see if there's any questions.
All right.
Thank you, Madam Chair.
We have till 3:25 before we move to the next agenda.
I only have one other person
that'd be great
with us to sign up, but
and I have it's Lynn Sweeney, Lynn Sweeney, and Laura Caldwell. Mm-hmm. Okay, go ahead.
Laura, okay. Well, good afternoon. Thank you for allowing me to share. My name is Laura Caldwell, and I live in Eugene. and I'm very honored to share my story in support of this bill. I am the mother of 3 children, and I've been happily married for 26 years. In August of 2011, I had my annual mammogram, as I've had for the previous 6 years. The mammogram came back clear and fine. I don't have breast cancer in my family, so it's a test that I was never worried about. And I do a lot to help reduce my risk factors, so I was not worried about the test. A month later, after several days of pain under my arm, I went to see my doctor. Noting that I had a clear mammogram, she put me on a course of antibiotics and asked me to return should the pain continue. 10 days later, and still referring to my clear mammogram, she sent me for a diagnostic mammogram just to be safe. A diagnostic mammogram is just a fancy word for an ultrasound. My ultrasound revealed a lump, and a biopsy confirmed invasive ductal carcinoma that had spread to my lymph nodes. When the diagnosing doctor called to tell me the news, just 8 weeks now from my normal mammogram, I asked him why the mammogram hadn't caught my tumor. He said it was because I had what was called dense breast tissue, and that the tumors just don't show up as easily on mammograms of women with dense tissue. In fact, he said he was looking at my now 8-week-old mammogram, and he still couldn't see the tumor on the scan, even though pathology confirmed the cancer diagnosis. When I questioned the doctor further, I said, "No one has ever told me I have dense breast tissue." And he replied, and I will quote him, "We don't usually tell women that information." I would find out later that my tumor was 2 years old by the time that we discovered it. It could have gone undetected even longer had I not developed those symptoms. And in essence, I probably had 2 to 3 clear mammograms, all while living with a growing cancer. Despite the fact that 40% of women have dense breast tissue and women with it are 4 to 6 times more likely to develop breast cancer, fewer than 10% of women with dense tissue are informed about it by their doctors. And as you can see from my story, I only found out about my dense tissue and ultimately my cancer from that additional screening. Having dense breast tissue is a risk factor. There's no history of breast cancer in my family, but breast density is a more significant risk factor for developing breast cancer than having a first-degree relative with it. My work as a consultant and trainer with the Pampered Chef puts me in front of hundreds of women every year. I have discovered as I have shared my story with them that the majority of women have never heard the term dense breast tissue, let alone if they have it and that it's a risk factor. We all know that early detection is the best possible way to treat breast cancer, but women are not hearing about their breast density from their doctor, and that makes it harder to catch these cancers early. I cannot help but think that had I known about my tissue density, early detection would have prevented it from spreading. My cancer, as with all cancers, show up as white on a mammogram. Unfortunately, dense tissue also shows up as white. Women should be receiving the information in their doctor's offices, not after they find out they have cancer. I've also encountered women that have discovered that they have dense breast tissue, many with a history of cancer in their family, that have had to fight with their doctors and insurance companies to get the necessary screenings. I am thankful that this bill would guarantee women the ability to get those additional screenings. My cancer diagnosis classified my cancer at stage 3. My cancer was not, I need a tissue. My cancer was not detected early because of the failure of mammography technology to detect the cancer in my dense tissue. I'm encouraged by this bill that would notify more women earlier and provide additional screenings to those women that need it. Oregon has one of the highest rates of breast cancer in the country, but it has one of the lowest death rates. A shift could happen dramatically in either direction depending upon the passage of this bill. In 2012, I completed 4 months of chemotherapy, a bilateral mastectomy, with lumpectomy, and 7 weeks of daily radiation. I went into remission last March. Unfortunately, this last Friday, the doctors have found a new tumor, this time on my brain. They believe it is most likely the breast cancer that has moved through my lymph system and settled in my brain. I will have it removed 1 week from today. There are only 5 states in this country that require doctors to tell women about their breast density, and only 2 of them that include the insurance portion. I implore you today to make Oregon the 6th state. Please move this bill along and pass it. It is important to my daughter, who will probably inherit dense breast tissue, to my future grandchildren. It is important to the state as a whole, to women and to men and to children and to the future generations of our state. You will be saving many lives with this bill. Thank you.
Oh, thank you so much for coming and sharing your story. Humanizing policy work really makes a big difference in the decisions that we make.
Thank you.
Thank you very much.
Good afternoon, Chairman Moniz Anderson and the rest of the committee. My name is Lynn Sweeney, and I live in Southeast Portland. I myself have not suffered from cancer, but Laura is my sister-in-law. This bill is very important to me because she's being treated for cancer currently that began in her dense breast tissue. She was unaware she had dense breast until her diagnosis. I'm so torn up that she's going through this, and I don't want to lose her. I feel so helpless because there's nothing I can do directly to affect her health. She's so dear to our family. The only way I can help is to urge you to move forward with this bill. Then maybe other women will have their cancer detected during routine testing. My sister-in-law didn't get that chance, and I hate to say this, especially with her in the room. She might die because of it. Here are some facts about dense breast tissue and cancer. Breast density is a well-established predictor of breast cancer. In dense breasts, mammograms miss half of the cancers. 40% of women have dense breast tissue. Adding other tests, such as ultrasound, can increase detection by up to 100%. Therefore, knowing if you have dense breasts is vital to making informed decisions about your health. Now, there's no requirement to even tell women or to provide an ultrasound. Here's another sobering fact. 95% of women do not know their breast density. I'm very surprised healthcare providers don't routinely provide this information to women. Is it because they fear increased cost of testing? Or perhaps they just don't think women need to know? Either reason is indefensible. I strongly urge you to move this bill forward. Oregon women need this. In closing, I would ask you ladies, do you know if you have dense breast tissue? Gentlemen, do your significant others know if they are dense? Thank you.
Thank you so much for coming. Yes, Dr. Steiner Hayward.
Thank you, Madam Chair. I'm going to start getting all choked up about this one. I'm very proud to be co-chief sponsor of this with Senator Dingfelder. And I apologize for coming in late. I was dealing with a couple other things, but I've spent the past 10 years of my career as a physician at OHSU working on improving early detection of breast cancer, primarily in my case through clinical breast exam, because often in women with dense breast tissue, a really high quality clinical breast exam can help a lot to find breast cancer early, because even in dense breast tissue, cancer feels different than normal tissue, or can feel different. No one should have to go through what you and your family are going through. And the more we can do to prevent that, the better. And the more that we can empower women and men by educating them about breast density and how it can affect both cancer risk and the effectiveness of mammography as a screening tool, the better. We want to be in partnership with our patients, and that means educating them. I would like to take the liberty of clarifying one thing you said, if I may.
Yeah.
The reason that this bill is so important to me is that a diagnostics mammogram is very different from a screening mammogram. And what that means is that in a screening mammogram, for everybody in the room who's ever had one, and for those of you who haven't, is generally 2 views of each breast. The radiologists take pictures from 2 different directions of the breast. A diagnostic mammogram, and a screening mammogram is covered 100% under Oregon law and under the Federal Affordable Care Act. screening tests for certain common diseases are completely covered. But a diagnostic mammogram is when we suspect something's wrong and we have a concern. A woman has a mass, there's something else concerning on the screening mammogram, and at which point they go in and take a lot more different pictures with the mammogram machine, not just with the ultrasound. And diagnostic testing is not covered 100% under the Affordable Care Act or under Oregon law. And we run into a challenge there because as soon as we convert from a screening mammogram to a diagnostic mammogram in a woman with dense breast tissue, if there's anything of concern, then it's not covered 100%. Leaving ultrasound completely aside for the moment, just getting the additional views changes it to a diagnostic mammogram, and that's where we run into trouble. So empowering women by educating them and finding a way to parse that difference in women with dense breast tissue where we just aren't getting enough of a look to figure out a way to make it affordable for women to get that additional testing but still keep it as a screening test is where we need to be moving to prevent stories like yours.
Thank you.
So thank you all very, very much. Thank you, Senator Dingfelder, for including me on this. And I look forward to continuing to move this bill forward as fast as we can.
Thank you.
Thank you.
Thank you.
And Laura, is that your daughter and husband?
Yes.
Yes, welcome. And our prayers and thoughts
Thank
are
you.
sending positive energy
Thank
your
you.
way
Thank
for
you.
next week.
Thank you, Madam Chair.
Thank you.
Thomas Bruner.
Madam Chair and committee members, I'm Thomas Berner. I'm the CEO of Susan G. Komen for the Cure in Oregon and Southwest Washington. And I'm here to lend our support for Senate Bill 420. And I guess to be quite honest with you, all I can really say is wow. It is unconscionable to us that after 30 years of fighting like hell to educate women about breast cancer, to educate the medical community and healthcare providers about breast cancer, that we've come so far to only have so much farther to go. The fact that most women know nothing about density, nothing about its complicating factor in screening, is unconscionable to us at Komen. We are wholeheartedly in support of any and all efforts to continue to educate women about breast cancer, including breast density and the role that density might play as a risk factor or in complicating screening or diagnostics. And whether it's screening or whether it's diagnostic, let's be clear. Whatever it takes to find it is the right thing to do. And we encourage you to make sure that Oregon is a state that doesn't say no to a woman whose life could possibly be saved. So cover it. Thank you so much for having us.
And Sandy, I think that we will need information on the costs of the screening tests versus the costs of the diagnostic tests. We will need to have a fiscal to see the impact it has on OWEB and PEB to see if it's a Ways and Means referral or not. And so that's the type of information that we will need before we go forward.
Thank you. Thank you very much, Madam Chair. I know you have a lot of people behind you that like to testify in another bill. We really appreciate you putting this as a priority and look forward to further discussions and hope that we can work together to move this bill forward.
Great.
Thank you.
Thank you so very, very much.